Strengthening the concept delivery of South-South cooperation and the understanding and support for partners in population and development were key objectives proposed during a breakfast meeting jointly hosted by the UN Mission of Bangladesh and the Mission of Partners in Population and Development, held in New York on Monday. The meeting included UN ambassadors from partner countries, experts from UN Women, UNICEF, and UNDP's Special Unit for South-South Cooperation.
South-South cooperation itself is a very laudable initiative, and it is true that it is not very well understood. And so what is it important is that you must have commitment, and commitment from the policymakers to move forward. And secondly, commitment should be also tied up with policy decisions. And so there should be also policy decision and institutional support at the national level to promote South-South cooperation. And besides institutional support, we need also to have very important resources. So each of us should put up our resources together and move forward.
In many of the South-South countries, there are good programs. Like, for example, Bangladesh. Without any mandatory program, we reduce our population growth rate by half, from almost 3% to 1.4. It's a remarkable progress, and without any mandatory program. Now that expertise, how we did it? Through public awareness, by involvement of civil societies, non-government organizations, and of course the government, direct involvement of government. Now that expertise should have been promoted in other, South-South countries. Many are suffering, but the good thing is PPD can promote those, and of course South-South News can promote those experiences.
Partners in Population and Development is facing inadequate funding for family planning, and the impacts of climate change, immigration, and migration are accounting for more displaced populations and food insecurity. Experts suggested establishing more demand-driven initiatives and country-specific mechanisms, which include the private sector, civil society, and NGOs, to help in achieving the International Conference on Population Development Goals and the MDGs, including increasing access to women's health, slashing child and women mortality rates, and combating HIV/AIDS.
In the 80s, a lot was gained in terms of curbing population growth and in reducing fertility rates in the global south and also in Africa. But those gains have been reversed by the scourge of HIV/AIDS. HIV/AIDS for the populations of the south bears the face of a woman. The challenge is now for organizations such as UN Women, UNICEF, and other partners to now improve the status of women of the south so that they can more ably handle their own fertility and also reduce the spread of HIV and improve their own livelihoods.
We have been quite active in reproductive health, and we've been maternal, maternal health, and we've been sharing our experiences with fellow developing countries, best practices and that kind of thing.
Partners in Population and Development is an intergovernmental organization consisting of 25 developing countries from Africa, Asia, Latin America, and the Middle East. It was established to promote South-South cooperation, providing mechanisms to harness partnerships and cooperation between developing countries. The next PPD conference will be held in South Africa from October 31st through November 1st, covering key issues such as population dynamics, climate change, and sustainable development. Afaf Kanja for South-South News, New York.